body is an amazing creation. It's capable of accomplishing so much. For example, our legs take us from place to place without even having to think about it. Our blood flows through our body like a river, and women are able to nurture a fetus until we give birth. But what if we aren't ready to have children? That's where birth control plays a huge role in a lot of women's lives. It's one thing to live the life, to actually experience menstrual cycles, finding the right birth control, and to give birth to a child. You may not need to go through all these events yourself, but you should acknowledge the fact that some of us do and to be empathetic towards those. What I want you as my audience member to do is to recognize that birth control is a much more complex topic than you think. It isn't done for just one particular reason. There are a lot of factors that contribute to the decision of being on birth control. I want you to understand that this is a natural thing, and that though you may not need birth control yourself, you shouldn't feel uncomfortable talking about it. Birth control is a right that every woman should have. We shouldn't be looked down upon just because we make a decision that doesn't affect you and just ourselves. During this presentation, I'll be talking about a few kinds of different birth controls, their effectiveness, the benefits that come along with said birth control, and how they may affect the menstrual cycle. So, what are the different kinds of birth controls and how effective are they? In this diagram, shown from least effective to most effective, we have the IUD implant. The next one on implant, both of these I'm going to be talking about later on. In the OK section, the one that I will be mentioning is the standard birth control pill, and in the least effective, there is the condom, pulling out method, tracking your cycle, and the diaphragm. So one of the most common forms of birth control, like I stated, is the standard birth control pill. These you take every day at the same time for as long as you wish. So the birth control pill comes in a pack of 4 weeks. 3 of those weeks contain hormones that affects the ovulation process. It, in the end, just gets rid of it completely so that there's no fertilization that can happen. The last week is just a sugar pill. So that means that you can get your period. The other form of birth control, which is fairly known and talked about, is the IUD. These have 2 different kinds of IUD. There's the hormonal implant and the copper implant. The hormonal IUD, just like the pill, has hormones in it. The difference is that once it's in, you don't really have to worry about it at all. It also halters the ovulation process, but the IUD implant also thickens the mucus around the cervix so that sperm can't get through. The copper implant, however, acts a little bit differently. The metal itself reacts with the sperm so that it can't swim and fertilize any of the eggs. So if someone who doesn't like to have any extra hormones in their body but want to be on birth control may end up going that route. The effective rate for a birth control pill itself is 91%. So that means only 9 out of 100 women will end up getting pregnant if the birth control pill is their only form of birth control. The IUD, though, has a higher rate at over 99% effective. Fewer than 1 in 100 women will end up getting pregnant from just using the IUD. The only way that you could potentially lower the effective rate is if it was placed incorrectly, so that's why it's really important to do research, go somewhere where it's trustworthy and credible. So yes, birth control helps prevent pregnancy, but what else can it do? One of the other common things is acne. As tweens, we are cursed with acne. Women have one slighter advantage. We are able to go on birth control. When I was around 12, I started growing. I had androgens pumping through my body, and birth control pill halters that. It helps regulate it, lower it, so that it's not overly producing oil, which then leads to acne. The other reason why women may want to go on birth control is because their menstrual cycle may be really extreme. A lot of women may experience heavy bleeding, which can then lead to anemia. They experience heavy cramping, constant migraines. With the added dose of hormones, it can help regulate how hard your menstrual cycle is. So it will lessen your symptoms. It will help prevent pregnancy. It can help regulate acne. So now that we went through some of the pros, preventing pregnancy and also helping acne, menstrual cycles, what are some of the cons? Well, One of them is that some women experience birth control a lot differently. They have a different experience than most women. Some women decide to try any kind of birth control can have an increase in migraines. Changes in the female sex hormone like estrogen and progesterone may trigger a response like this. Low doses have a lower risk of causing migraines, but it's still a possibility. And also, prolonged periods are also a possibility some women may have. For contraceptives, such as the IUD, which is the one that I have, or the Nexplanon implant, which is the one that goes in your arm, it takes a while for your body to adjust to the added level of hormones going on. This may lead to having your period for weeks in a row, or sometimes even a whole month straight. Others may experience spotting or being on and off for a while, which is something that happened to me. After a while, though, if you're patient enough, a lot of women will see that your period eventually gets lighter or it just stops altogether. Another rare yet very plausible side effect of birth control are ovarian cysts. These are like little blister bubbles that form on the outside of your ovary. Though normally fairly small, once it ruptures, it can stimulate a pain similar to childbirth. Speaking from experience, it isn't fun. Symptoms of an ovarian cyst rupturing is similar to that of appendicitis. Both contain pain in the lower left abdomen, but depending on which side your cyst is on, it could be the lower right. It also includes nausea and lower back pain. And one of the other birth controls that I have talked about is the Nexplanon implant, which goes in your arm, and a side effect of that can be scarring. To get that one placed in, there's a small incision placed, which then a device containing the birth control itself is slipped in underneath your skin of your arm and then pushed in. Though it leaves just a small scar, a lot of women are really concerned about the cosmetic outcome of that procedure because you can also see it underneath your skin. But birth control can also serve as a barrier and protect many women. Rape and sexual violence is a sensitive subject, yet something that should be talked about more often. There are many states that are pushing for the restriction of birth control and abortions, yet they never mention the reasons why someone may need to get those. Around 3 million women have experienced rape-related pregnancies. In a lot of these instances, the woman may not be on any type of birth control, and the man may not want to use his own type of contraceptive. This leaves the window for possible pregnancy wide open. 1 in 5 women experience rape in their lifetime, so keeping options open to limit unwanted pregnancies is key. Birth control is effective in many ways. Not only does it reduce the risk of unwanted pregnancies, but it also helps regulate menstrual cycles, lessens or absolve acne issues, and other complications. By this presentation, I hope that you were able to see just how much more there is to birth control. It shouldn't be that easy for someone to want to take it away because there are so many other different benefits a lot of people don't talk about. I want you to be empathetic to those who choose this route, and though it may not be for the reason you think, don't just jump to conclusions. What would you do if you had a uterus? Do you think that you could live with the pain once a month, the acne, the mood swings? Would you want to try and find what's best for you?